I would like to call our first presenter up, Roadmap to Equitable Choices in Mental Health Outpatient Care. Yes, a round of applause.
Good afternoon. Okay, so what I'm here to ask for to increase the equity of mental health, outpatient mental health care, is basically a partnership where we link local schools, universities to recruit and follow students through a roadmap of undergraduate and graduate education. To provide, I need funding sources to support students with internships and postmasters, externships to fill a gap in their supervision requirements and the costs of those supervision requirements. Also thought partners and the formation of a nonprofit coalition to gather together to manage this whole process, and funding for a program coordinator and different community liaisons to reach out into the community as well as the educational institutions. So why? Well, aside from being a pastor, I'm also a licensed therapist. So I'm a licensed professional counselor. It's my second career. So when I went into the field, I kind of had a goal of being an entrepreneur when I got through the whole process. And I realized that many people that take this path run into a lot of different gatekeeping issues as they follow the path to licensure. Some of the hurdles: there's a big time and money investment versus the initial potential income that they may get when they enter the field. Also, there's kind of an indentured servitude period. After you get your master's, you still have to do 2 years of work, and if you're not licensed, then that means you have to work under somebody, and you work at a substantially less income during that period of time. Also, during that time, you have to do 2 hours of supervision, usually, per week of 40 hours of work. And usually, where you may work may only provide a half hour to an hour of licensed supervision, if that, and so you kind of have to foot the bill for the extra hours of supervision. And you have to carry that load for at least 2 years to get your license. If you have, and because you're unlicensed, you probably will work in a community agency where you can get the hours to get your licensure. Unfortunately, most of those jobs are fee-for-service, so you may be scheduled for 40 hours of work, but you may only get 20 some hours of contact time. And if the clients don't show, that means you don't get paid. There's also a trickle down of salaries. So most of those clients are Medicaid and Medicare. So the salary trickling down by the time it gets to you is usually very low. And then there's a burnout factor because you're seeing a critical clients with the least amount of experience, and you're trying to get a lot of hours, and you can burn out. So this is very discouraging to people, and it's a reason why a lot of people that could be good therapists don't enter into the field. So the challenge that we have is, how can we increase access to mental and behavioral health services in the greater Coatesville area? We can increase the diverse provider pool by providing a roadmap to success to become a licensed provider, provide guidance along that road to freedom and independence for providers, give them more options to go into practice for themselves if they want, and start their own agencies. How do we increase health promoting activity in the greater Coatesville area? We can use them during their education period to go into the community and increase awareness. If you look at the gap analysis, these are national numbers. Counselors by race, white counselors at 63.5%, and gender, female 61.5%. And so if you've ever tried to find a male counselor or a counselor of color, it's often hard to find. And in the Coatesville area, there's a huge lack of counselors in general to fill the need. So the solution that we came up with is to develop a roadmap to help prospective providers in the underserved demographic to navigate through the gateways to licensure and beyond. So kind of plot the course for them. So even when they go into the field at the bachelor's level or even in high school, they know what they're going to have to do to get to where they want to get, and it'll open up options for them. Interface with educational institutions in the area to recruit and track prospective students from high school on up, and roadmap them to encourage them along the way, and so they're prepared. Provide psychoeducational internships and externships to students where they educate and provide services in the community. Have in-residence programs placed in churches, mosques, synagogues, other community areas that can provide mental health education and guidance and an appropriate level of care based on the student's education level. Provide free licensure supervision for postmasters and doctoral providers, and start a nonprofit coalition to run it and coordinate it. So the benchmark is to launch in the fall 2023. Some milestones are to form the nonprofit and board, hire a coordinator and admin, explore funding, grant programs, and implement the community engagement program on down. And here are some initial financials that I just threw together, but they would have to be explored. So who am I? I'm Reverend Michael Green. I received a bachelor's at LaSalle University in computer science, and my initial career was in information technology for many years. I went back to school, got my master's in divinity, master's in counseling, and became a counselor. I was employed in information technology. Now I own my own practice, Legion Therapeutic Group, and I work in the mental health field. And I've had diverse experience in substance abuse, co-occurring disorders, medication-assisted treatment, treatment of people with personality disorders, trauma treatment, and children's behavioral health consulting. And now I'm the pastor at Bethany AME Church, and also I serve on the University of Pennsylvania and Chester County Mental Health Consortium. And that's my solution.
All right.
Turn it over to the panelists, and there's a microphone if you speak, or you can just speak very loud.
I'm going to go first.
Okay.
First, I just want to say thank you. This is, mental health is very near and dear to me personally, and it's very much underfunded and extremely needed. But
Can you hear me? Okay. I love the fact that you platformed your project around the training and the supervision, because a lot of people don't realize how expensive that supervision is, and the interns is what they are.
Right.
They're given the hardest cases, the biggest workloads. There is a lot of burnout, and they can't afford. I mean, I know some supervision hours start at $85 an hour for 1 hour.
Yep.
And it's a lot. So I appreciate that you came from that standpoint. So thank you.
I'm curious if you could explain a little bit more about how you envision the supervision, like who's going to be providing the supervision to the students?
So we would hire licensed professionals to provide supervision, run supervision groups, and provide individual supervision.
So you envision the coalition, the program coordinator, recruiting those folks to be able to
Exactly.
provide the supervision?
Exactly.
Great. Thank you.
Thank you also for doing this. We know this is a huge need in our area. I like the idea that the way you've put it in as a map, as a roadmap, because it speaks to guidance.
Yeah.
And I think in your graphic, if there's a way to kind of take that map or that roadmap vision and showing what you're doing in the various
Step by step.
steps,
Yeah.
it might make it a little more. We can visualize it better, because
Okay.
I had a little trouble following it. And then also you had a graphic that had, I think it was the min-max for what people make in the
Right,
different.
right.
Yeah, if to call that out, because it was up there, and just to remember to call that out. So, because you were using that to validate, what various people
Right.
earn, and then tie the roadmap back into how it changes what's happening now. Because I wasn't sure if the community agency model, if some of that is legislated, like they have to have so many years under supervision, or can you change? Like, how does your roadmap actually
That's all
change it?
legislated in the licensure requirements.
Yeah,
Yeah.
but how does your roadmap make it efficient and encourage people to come into this field, since
So it takes the big burden of some of the cost off of it, and it provide. You also, if you don't have a supervisor, you have to go out and find somebody, and so it would provide the supervisor, and it would also take the burden of the cost. Like she said, it could be, for 2 hours of supervision, it could be $200 a week or
Right.
more, and so would kind of help with that.
So I think just call that out graphically
Okay.
a little bit better.
Hi, thank you. I was really struck by the parts of your presentation that talked about all the licensing issues, the time and the money, and then the additional years you might need, and also focusing on the diversity pipeline issue,
Right.
which I think is really critical. And it's something near and dear to my heart in the educational world. We have the same problem
Same
with
thing.
teachers.
Yeah.
And it's the same licensing challenges, it's the same, pipeline diversity issues. And so I really appreciated that, and I think it's really important to keep those messages at the forefront. I also really like the idea of having a community coalition. We've seen those in other areas, work in other issues. So I think that that's something to continue to pursue.
Okay. Great.
So it would be great, and it's just how much can you do in one initiative, but
Right.
I think it'd be great if you could somehow incorporate working to change the system. I mean, I think what you're doing is great, which is helping people through the current system, but it's going to be, it's still, you're going to sort of nibble at it. And really, I think we have to take a hard look at these licensing requirements and how to get more diversity in the field. So,
Yeah.
But thank you.
Yeah,
That's
okay.
great.
Thank you for your presentation. I think it was great. I actually appreciate the fact that you share the statistics. Particularly, we've been serving here in Cookeville, for many years, and we continue struggling with behavioral health services, and the trust part as well. It's another challenge.
Yeah.
So I really appreciate that you're showing, the vision to actually support and give the opportunity for counselors to become counselors if they already have the trust of the community, so that will actually support the behavioral health service. So,
Thanks.
thank you.
Hi, thank you for your presentation. I think I'm probably going to repeat some of what has already been said, but I think knowing how challenging the workforce is nowadays across the board, and especially in the behavioral health field, I give you a lot of credit for putting this together, because it is a challenge that all students face as they're getting into that internship phase of their clinical work. And it's costly and it's taxing, and to be able to establish something to build a pipeline for clinicians to come out, get the experience they need, and the support. And also, I'm going to comment on the statistics too. I think it is really challenging to recruit clinicians of a diverse nature.
Yeah.
So thank you very much.